Hello, greetings to all our viewers and my regards and wishes to our viewers. This is to describe the story of Mrs Bridget, whom we had with us about 15 days back in our center. She is a lady of African descent from the country, a lesser known country called Malawi. She had this peculiar problem of a serious cardiac arrhythmia. She had been suffering with it for about 6 to 8 months. Problem was, it was a very temperamental arrhythmia. Frequently she would run into the symptoms of rapid palpitations with giddiness, and she would often pass out, and this often happened when she was physically active. She is a mother of 4, running a family, and there was a lot of responsibility on her shoulders, so she was extremely symptomatic and troubled by this arrhythmia. To the credit to her physician, who actually could tease out the diagnosis with the symptoms and actually was able to document the arrhythmia in ECG, he did actually appropriately refer the patient all the way across the oceans to India here in our center, and she did eventually come for a treatment, and I'm very happy and satisfied that we could successfully map the arrhythmia and eliminate the problem with doing a catheter ablation, which is standard and contemporary procedure. It's a very gratifying procedure that we have to offer in the field of cardiac electrophysiology, and she was discharged in a very stable and smiling conditions. I'm very fond, I'm very glad that she left with a very happy and a grateful good happy memories from India, and I'm glad to have represented our fraternity and be able to represent our country in a rather constructive manner. Thankful and grateful for all that.
Good afternoon, my name is Alinafe Sawasawa. I'm here with my sister Bridget Sawasawa and Dr. Vikram. We're from Malawi. I'm based in Lilongwe, and my sister stays in another small city in Shewo where she teaches. And one morning she called me that she has pain on her chest, and then because where she's staying is a small city, I invited her over to where I'm staying in the capital city so that we can go to a better hospital. And then after they examined her, they found out that she has a problem with her heart, and she went into cardiac, and then they managed to stabilize her. After 5 days, we got out of the hospital, and then I have a friend doctor in the city whom I contacted to find out from him more where I can get more help, because the hospital I went, they said they could only give her like medicine for the rest of her life, so that she can control the situation. And then when I contacted Dr. Victor Mazopa, who is in the city, the Central Health Clinic, she helped me to contact Dr. Vikram, and then we made appointments, and everything was done, the documentation, the visa and everything. And on 30th April 2022, we started our journey to Apollo Hospitals. We arrived on the 1st in the evening, and on the 2nd of April we were admitted at Apollo Dubricus. And on Wednesday, that's when my sister had her EP, and then they found out where the problem was. They gave us some few days to wait for another team, which helped us to have an ablation on Monday the 9th of May. So as you can see her, she's stable, she's fine. All the complaints are gone. She's so happy to receive treatment at a very short period of time. So we're just grateful for the team here at Apollo Hospitals. They are so warm. We were treated like VIP. We had a VIP treatment. The food, accommodation, reception, and everything was really, really nice. We felt at home. We are encouraging and asking you to please do this to the rest of the people who come here with their problems. Especially in Africa, we don't have facilities to help us with such situations. So we'll keep coming, and for the people who will keep coming here, please do the same as you've done to us. We're very grateful for the whole team here. Thank you so much.